Lifting from the floor often requires special considerations that depend upon how the patient came to be lying on the floor. Please note, in the event of a fall, competent medical advice should be sought before lifting to determine that a lift will not cause any additional harm. The sling can be placed under the patient in the same way as shown when lifting a patient from a bed. While lying on the sling, the patient may be slid to an optimal position for lifting if needed. Be careful when bringing the lift into place. Ideally, the patient should be lifted with their head toward the lift mast, so the patient's center of gravity is more directly under the sling bar. Please note, care should be taken to place the lift at an angle to the patient's body so that the patient will not come in contact with the lift. With the sling bar in its lowest position, as always, attach the back support straps to the sling bar first. When the leg support straps are connected, hold them so that they remain flat against the patient's thighs without bunching or twisting. When lifting from the floor, it is recommended that wheel locks be used to keep the lift from shifting position and possibly striking the patient. However, when transferring to the floor, the wheels should remain unlocked throughout the procedure. Please note, hold on to the leg support straps until the patient is fully upright to maintain control of the patient's position. Transferring to or from a wheelchair can be done from the side if necessary, but it is best done from in front of the chair. To make the process smoother for the patient and the caregiver, we recommend that the wheelchair be tilted back to meet the seating angle of the patient. Note that this may not be possible with some bariatric wheelchairs. Once the patient is properly seated in the chair, lower the sling bar below chin level. Disconnect the sling straps while holding the sling bar still. Leg supports may be removed from dependent patients by folding the strap underneath the fabric and pulling the supports up or out to the side before removing the entire sling. Transferring a patient to or from a fixed chair, whether with a high or low back, is similar to the wheelchair procedure without the tilting. For the best upright position, apply gentle pressure to the knees or thighs as you lower the patient. This will position their buttocks to the rear of the fixed chair. In addition to the wide range of lifting applications, Viking can also be used for patient ambulation and gait training. Depending on the patient's support needs, the master vest or lift pants may be used. This training is possible for patients between 4 feet 10 inches and 6 feet 6 inches tall, and from 90 pounds to 660 pounds. Be sure to take advantage of all of the Viking resources available from Liko. Learning these simple procedures will pay off in years of safe and comfortable lifting for patients and caregivers alike.